It gives me enormous pleasure to be able to welcome our Minister of Health, Professor Ernst Kuipers, joining on the stage. We've had many questions from many of you, which we cannot cover all, but made a selection and have some room for free conversation. And the question and answers section will be moderated by Renzo Guinto and Joyce Browne. Ernst, Renzo, Joyce.
We go. Yellow chair. Yellow chair.
A very good afternoon to all of you. We're very honored by your presence, and it's not just us who have a lot of questions. And we've been here together for the last 3 days, and I know many topics have sparked questions. So we were very excited that we are giving our audience now an opportunity to ask these.
So my pleasure to be here,
Yes.
real pleasure.
And what is important to
And also very good and very nice to see Professor Grobbee again, who just did the introduction. We've known each other already for many years, and several years ago I had the wonderful opportunity to actually be the promoter of the daughter of Rick Grobbee.
Wow.
And she did a wonderful job.
the power of personal connections, and that's very clear. Yeah. It helps in health and research and global health.
Yeah, and you know that when you're allowed by Professor Grobbee to actually be the promoter of his daughter, that means something, right?
It does. One of the topics that has been an undercurrent of the past few hours, really, are the results of the Dutch elections. And I think for all Dutch people, it's very clear. Probably for everyone else, it's also clear because of the conversations you've had. But we had a substantial change in our political landscape. And coincidentally, we also have a question that links to this.
And you want to start with that as
And I would like to start with that question.
Small issues first,
well,
before the big ones.
One of the things we talked about was were elephants in the room. So
Correct.
This is a major elephant that we need to come to terms with. So with this, I would like to invite Lianne Hulshof to stand up and ask your question. There will be a microphone here. And for everyone watching online who might not be aware of the process, so people submitted questions until Tuesday evening. We selected a few, and we're very happy that you're the first one who asked your question. So please go ahead.
Yes, thank you. So I'm Lianne Hulshof from Delegates here in Utrecht. So I think we all know planetary health is really important, and I actually believe that we quite often already have the solutions to solve many of the planetary health related issues. However, I feel we often lack the political power to really implement those solutions. So my question is, what can we as health professionals and researchers and policy makers actually do to help implement these solutions and to improve the situation a bit?
Yeah. And that in relation to the elections yesterday. Well, it's quite a task. No, thank you very much, and it's a very relevant question. And without going to discuss in detail, we don't have the time, and it's not the setting, the outcome of the elections. I think, first of all, that what we saw with the elections yesterday, and what we already saw in the weeks before that, is that people do realize that the global situation and equity and access to healthcare, etc., are very, very relevant, but that for understandable reasons, we often, as a public, as a voter, first of all, translate it immediately to ourselves, sometimes without recognizing that we are part of a larger world, and that solutions always have to come also from the international connection. But then coming to your question, what can we do, what can you do? I think first of all, and that's also the importance of this multi-day meeting, is realizing that your voice and your opinions and your research and your teachings, etc., really make a difference, really matter. But that to make it also have a maximal political input an impact, both on a national level as well as on an international level, that it also really asks concerted action. And that's difficult. It's difficult for politicians, but it's also difficult for researchers, clinicians, healthcare executives. And what often happens in science and also in healthcare is that because we fail to bring the most important messages and pathways towards solutions in one voice and bring that across, we actually fail to have the political impact that you all should have. And do not underestimate that. If there is one clinician, one researcher, one professor, one healthcare executive who for a particular issue says this is important, and another one immediately puts in a disclaimer and says, well, I don't think it's important at all. If one says this needs further research, and the other one says, oh no, this has already been sufficiently researched. If one says this is caused by A, and another one says this is caused by B, and we continue to do that almost on a daily level, then by the end of the day, you lose a lot of the political impact. And let's face it, I mean, with all the beauty of politics, it's also very much driven on a daily basis by incidents, by opinions, and not always by facts. So if I can give one advice, make sure that you agree after a meeting of this on the two issues that are most dominant. Always realize that when you do so, that on a personal level, you might want to add something else, but that the message is stronger if you come with it across, all back home to your own government and policymakers, but also continue to do that internationally again and again, because you can make a tremendous impact, and we do realize that the challenges are huge.
Thank you, Minister, for those words of encouragement to especially our next generation global health leaders who are in the room. Yeah. Joyce alluded to the political change that just happened within the past 24 hours in this country. I'm not from the Netherlands, I'm from the Philippines. Yeah. And I'm also interested in another kind of change that we're now seeing worldwide, and that is climate change. Yeah. In roughly more than a week, the world's governments will be convening in Dubai. Yep. And there will be more negotiations. In fact, we've been negotiating for 28 years now about the future of our planet. I come from a country that is always, unfortunately, top-ranked in terms of climate risk and vulnerability. Meanwhile, yes, the Netherlands, as I understand, is also affected by climate change, but it is also contributing, along with many industrialized nations of the world, to greenhouse gas emissions, for example. So I just want to pick your brain on what is the role of the Netherlands in addressing climate change, in accelerating action, and maybe in particular in the upcoming negotiations in Dubai.
Yeah. So, yes, it's very important, first of all, focusing on the meeting next week, actually, in Dubai. I will, with the team, attend.
See you there.
For understandable reasons. And it's extremely important, and glad that this is now a separate topic. In fact, we are also, the Netherlands, together with Peru and with many other countries, we are working on a resolution which hopefully will be accepted next year at the World Health Assembly. Also further emphasizing the need for climate action on behalf of the health of our populations. And it's for good reasons that the World Health Organization, as you know, has stated that climate change is the largest and most important threat to our global health. So we need a lot of action there. Now, in the Netherlands, apart from leading this also international, we realize very much that climate and climate change will affect us on a global level, also in the Netherlands. And sometimes it also refers back to the question that we just had. First of all, translating in what does it mean for somebody here in your own country, or for what does it mean for somebody in the Philippines, helps to make people realize whether they're a citizen, a patient, a healthcare worker, healthcare executive to realize we really need to take action. If you look at the situation in the Netherlands, to start with that, and you know the data very well, when you talk about climate change and healthcare, many people will first think and do not come much further than, oh, there may be an increased risk in the Netherlands of heat stroke. Our allergy season for people who are prone to that may be a little longer. Well, this is the least of your concerns. You know very well that if we, for instance, simply look at the modeling of what an increased temperatures in the summer will do in combination with the challenges that the Netherlands has in terms of water management, we are a country which is for a significant part below sea level. For centuries, our main emphasis in terms of water management always was to get the water out as quickly as possible, otherwise we would drown. Now, with on average still the same amount of rainfall in a year, but very much concentrated in the fall and in the winter and very dry summers, we now have to completely undergo a paradigm shift, and instead of getting the water out, keeping the water in. But if you have large areas and stores with fresh water, in combination with temperatures in a summer for prolonged periods that are higher, then you already can do the modeling and see that countries like the Netherlands in 2040, not in the year 2300, no, in less than 20 years from now, can be prone to vector-based diseases, and these can be countries which are endemic for diseases like malaria and dengue. Wow. If that is on the agenda, if that is what we see through our future glasses, I'm pointing to the wooden glasses over there, then this suddenly makes it a totally different picture. Now,
oh, just a minute.
So
I can repeat the question because not everyone might have heard it, but I would like to ask the audience to also be respectful of the conversation we're trying to facilitate. If you do have a question, please raise your hand. But the question is, what are we going to do about it? And maybe, if you allow me to add, what might we be able to learn from other countries that are facing all these challenges already?
Yeah. So in terms of what we need to do about it, we need to first realize the importance, but also that there's a double-edged sword. It works two ways. Climate change will affect our health, but the way we provide healthcare today actually contributes to creating the patients of tomorrow. And you know very well the footprint, ecological footprint that our healthcare has in broad perspective, whether it's on carbon footprint or it's the use of rare materials or it is, etc. It's pollution, water, etc. So for one, focusing on we really need to change the way we provide healthcare. And there are many ways of doing that. Secondly, we also have to produce, and this is a global issue. This is not just the Netherlands. Many of the things in which we provide healthcare are actually based on international rules, EU regulations, etc. So it's working collaboratively. It's also the need for the World Health Organization and the resolution collaborative to change that. In another ways, also helping internationally for countries which are even much more challenged, and you mentioned some, than we are here in Western Europe. That's a reason that if we just look at the political situation here in the Netherlands, again, we have new elections, we will see what we come. If we focus on the current government and also on my own party, we put a lot of emphasis on energy transition and climate resilience, with a lot of effort in that. Also helping healthcare providers to make a transition into providing healthcare in a different manner.
Mm-hmm. Renzo, I know you can improvise, so I'm going to put you on the spot.
Yep.
And we have talked about this in the past. So Renzo Guinto has a very good overview of what happens in Southeast Asia and what kind of climate resilient healthcare initiatives are being developed. You were also in a session just
Correct.
now.
This morning.
This morning, yes, sorry, this morning. Can you share some of the highlights? What can the Netherlands learn from everything the Philippines and other countries in the low-middle income countries have gone through before?
Yep, and when Ernst was mentioning about the water issues in the Netherlands, what came to my mind was, wow, there's a lot of opportunity for cross-continental learning even, right? On how to address, these shared challenges. Although, for example, in this morning's session, there was a discussion around who needs to reduce their footprint, ecological footprint, and who needs to adapt. And we agreed that high-income countries, such as the Netherlands, do have perhaps an extra responsibility to make sure that they decarbonize, reduce their carbon and ecological footprint, and also to support other countries transition towards, for example, green energy in healthcare. Maybe you can share some of the concrete initiatives of the Dutch government, for example, in trying to ensure that you decarbonize at home, but also you help other countries achieve their climate goals, whether it's for adaptation or mitigation as well.
Yeah. I already mentioned the international collaboration and the work that we do in getting a World Health resolution accepted, which focuses on this very, very broadly. And a lot of the regulations when it comes in, for instance, on the way we provide healthcare are international. And what we do is just focus together with the EU, but also with further international colleagues on optimizing and providing other ways of healthcare, other ways of, for instance, reusing and repurposing drugs, less use of raw materials, other packaging, et cetera, et cetera. One other which we often have in the discussion for very understandable reasons is also financial issues. Can we also financially support? And this is a topic of a lot of debate very broadly, as you know very well. And without making any specific statement, we know it on every individual level. We know it in the international collaboration. We know it also on a national level. When we, together with many parties in Dutch healthcare field, came to a Green Deal, as we called it, one of the immediate questions to a government was, okay, from every individual healthcare provider, can we please be financially supported to make an energy transition, to come with our own clean water supply and water clearance, etc. And if you start a discussion like that first, nothing will happen for a very long time. So my focus is on everybody needs to take their own action, while also continuing and looking at options, including financial options of helping each other also with the finances.
Thank you. You already mentioned the WHO resolution on climate and health, and we do have a question about this. So I would like to ask Juliette Uriza to ask a question. We have heard some of it already. Yes, someone is coming your way. Maybe a follow-up question to what we heard.
Yes, I am Juliette. I'm from the Global Public Health Department of the UMC. And yes, in light with this resolution, maybe could you give us a specific example of how the Netherlands could be a model, a realistic model to the world in global and planetary health? I mean, this resolution, the Netherlands is leading with Peru, Barbados, Kenya, Fiji, and the United Kingdom. But what are specific aspects and challenges of this resolution? And as you said, for the 2040, how can you imagine the idealistic Netherlands as a model for the world?
Okay.
Big question.
Big question. So part of it, priorities and topics within the resolution, and otherwise, are we leading by example?
Yeah. Let me mention several aspects. First, when we're discussing climate and health, the understandable primary focus always is on what will climate and climate change have as an impact on our health. One, in response to your question, one of the first very important issues that we brought in from the Netherlands, and which is in particular true again for the high-income countries, is the realization that healthcare by itself has a major impact and is a major contributor to our climate change, which changes the perspective, because it actually means that you do not have to simply prepare and make your healthcare system future resistant. No, we have to act now and reduce the footprint of the way we provide healthcare. And that basically asks for a whole range of actions, whether it's from energy consumption, it's from wastewater management, from freshwater management, it's from production of materials, it's use of drugs, it's packaging, etc., etc., etc. It's regulations on infection prevention. And that was quite an eye-opener for many other countries, but it actually helps. And you can share the examples there. And if we just look at the Netherlands, if you look at the impact and the discussion, for instance, when it is on for instance, a carbon dioxide footprint, the obvious examples that we always bring forward are our aviation industry, or, for instance, our heavy metal industry, like Tata Steel in the Netherlands. Well, as you probably know, if you just look at the Dutch aviation and Tata Steel together in the Netherlands, their carbon dioxide footprint is smaller than the Dutch healthcare. Smaller. Wow. Okay, so beautiful to continue to talk about what can we do at aviation, what can we do at the steel industry, but let's also focus on healthcare. It's not easy as a minister, because it would be very easy to just stay quiet about this. Let's not do anything at all. No, you have to change. Or if I can make a very practical example that many of you probably do not realize, if you just think about wastewater production by an average hospital, I don't know the international figures for all the different hospitals, I don't know them for the Philippines, but I do know them for a Dutch hospital. A large-sized Dutch hospital produces up to 200 square meters, cubic meters of wastewater per hour. 200 cubic meters per hour, 24/7, 360. So if you just look at what we now usually do is just dump it. If you want to clean it, what it all asks in terms of all the efforts, it's tremendous. Can we change it and can we adapt that? Yeah, relatively easily. It already has a major impact, just starting at your own institute, simply by first realizing that this is the impact. I was a healthcare executive, I was leading a hospital, a CEO of a hospital at the time when I first learned. If you would have asked me before, I would have made a totally different estimate. So leading by example, but also knowing and sharing the solutions.
So we already talk a lot about climate and health, and for sure we can't cover, this vast space. Let's shift gears a bit. And we have actually one question from Marta Maquero from Malawi. So
okay.
Let's hear from Marta.
The beautiful country of Malawi.
Thank you.
Blantyre, or where are you from?
Blantyre,
yeah,
Mangochi.
Yeah.
Thank you. Martha Maquero from Malawi. I'm a medical practitioner, clinician, but also I'm a program director for the family medicine program there.
Yeah.
My question is about you as a policymaker and medical doctor as well, and aligned to the global health values and commitments that the Netherlands have. Please share your thoughts in how we can ensure that the need for the training about the important themes on planetary health, but also health equity, how can the need be communicated and supported? And better still, when you look at the health education collaborative partnerships. How does collaborative and equitable partnerships in as far as medical education or global health education look like? What are those models to you?
Yeah.
Thank you.
So thank you very much. It's a combined question, or several questions actually.
Indeed.
First of all, with respect to the training, I think that it is, and you may already have guessed from my previous questions, that it is extremely important that healthcare workers, in the broader sense, nurses, physicians, others, learn about the major interaction between planetary health and our own health, now and also in the decades to come. Again, I mentioned the statement, which may have been for some, not for you, but for many of your colleagues back home perhaps, an eye-opener, just learning that the World Health Organization stated that climate change was the largest threat to our health. Wow. So we have to teach that to the upcoming generation. You all have to do that and continue to do that in a very important way. And this focuses on all the different aspects. It also focuses on diversity. It focuses on our microbiome. It is so many aspects which are all related. And you know that in many countries we are already far down that path, but it's also happening in Malawi and in Africa, that changes over time with the next generation, also due to changes in our environment, actually affect, for instance, our microbiome, which again affects our health in a negative way often. So teaching this, and thus also learning how to take this into account when practicing after you have completed your education, is extremely important. Now, how can we then, because there was a next question, also collaborate on that? Well, by, again, getting back to meeting here, learning from each other, making the connection and building your network, and invite each other and share your, for instance, your teaching programs and your examples.
Yep. So while we're still in the issue of health workers' education, I think there's a lot of talk about, oh, let's inject more climate change and planetary health into the content. But I think another major concern that we should be thinking about is, do we have enough health professionals that can address these, emerging existential challenges? I come from a country that is overproducing health workforce, but some of them are being exported to countries, for example, here in Europe. I don't know how many Filipino nurses are here in the Netherlands. Maybe you can also speak to the issue of workforce shortage, the conditions of our workers, burnout, which is now a global pandemic, I think, within the healthcare sector. Because I think in as much as content is very important, we add more planetary health into the curriculum.
Sure.
We also need to also address the more, I guess, fundamental issues about the future of the health workforce.
Yeah. One thing which we definitely know is that with an expanding and aging population, we also need an expanding workforce. And with that, it may help to realize that the way we provide healthcare now is actually something which we invented about 120 years ago, 130 years ago, end of the 19th, early 20th century, at a time when simultaneously almost we started to understand the etiology of many conditions, in particular infectious diseases. We started to develop anesthesiology, and we invented radiology and radiological imaging. And they all came together. And it suddenly meant that there was a major shift in the way we provided healthcare. We institutionalized it, and we made it very labor intense. That was 120 years ago, and we still do the same today. And then with an aging population, with expanding knowledge, with further and further subspecialization, to mention only a few. What we are now facing is, in most countries, not in Indonesia, not in the Philippines, but in most countries worldwide, we see an ever-increasing gap in shortage in workforce. If you just look at the situation here in the Netherlands, Western Europe, 1 in 6 persons with a job works in healthcare. And at the pace in which we're developing it, it will be 1 in 5 in 2040 and 1 in 5 in 2030 and 1 in 4 in 2040. Now, that's not going to happen unless we are indeed able to have workforce also from elsewhere. One aspect which is extremely important in that is that there are many places where there is shortages, and what we have often done is to attract people, based on salary, for instance, from areas where there is already a shortage. And that is a very bad thing to happen. And another one is, sorry for that, but to make it complete, is that you see the issues also here. We already were talking about the Dutch elections, but they're in some phases similar to others. There is many political issues also related to it.
Yep. Well, go ahead.
Well, actually, we have someone in the audience. That's why I tried to very politely try to get this back to the audience, because Justine van Brugstede, can you please raise your hand?
She has a related question.
She has a related question to this, and I'm really curious. It links to the conversations we've been having here at ECTMIH. So please, Justine, go. Please ask your question.
Yeah, actually it touched upon it, but my question is there an ethical way in which migrant laborers can support the Dutch healthcare system?
Sure there is, but then I'll give you a political answer, but please also realize that this is a political answer. As always with politicians, you get a background from a ministry, but you're in a cabinet, but also from a political party. Yes, there is. One very important ethical issue I already mentioned, and first focus on the country of origin. An ethical way is only if people are allowed to migrate and work in another country, but that not by creating a larger issue and lesser access to healthcare in the country of origin. And internationally, we've seen that happen on many, many occasions up until today. Another very important ethical issue is when you ask people to come to a particular place, like come to the Netherlands, what do you actually do with their working situation? What do you do with their housing situation? What do you do with the salary, etc.? What do you do with the opportunity to also go back home when people want that? That's also very important ethical issues. Another important ethical issue is how do you make them actually part of the larger also workforce that is already at the place, at the situation. Now, if you ask my opinion, do we have a shortage in workforce in healthcare in Europe? Absolutely, we do, very much so. Is it likely that we will be able to accept very large numbers of healthcare workers, for instance, from the Philippines in the coming years? Chances are small, given the political discussion, which only further illustrates the need for really reinventing healthcare. And there are many ways in which we can reinvent healthcare. Looking at the opportunities, for instance, also that the digitalization offers, etc. We also need to do that, and there we get the two together. We also need to do that from the whole ecological and climate perspective.
And maybe to add two considerations, and also for the audience, there are very clear guidelines also from international bodies on how we can ethically recruit health workforce from abroad. Yep. And I do think it's a question that the Netherlands really needs to look at itself in the mirror at times to see, are we completely compliant? And I know this is a question that also has been spurred by recent media examples where the way we treat migrant workers that we recruit elsewhere might not completely be aligned to these values. And I would encourage, even in the missionary status, that might continue to be, or should be, a priority, because it's again the question of leading by example. If we want to make sure we treat healthcare workforce well, we need to treat healthcare workforce well, regardless of where they come from, if they work here.
Yeah.
Thank you.
Yeah.
So, so Joyce, since you already alluded to, international frameworks such as, the voluntary, the code on the ethical recruitment, I'm curious about the role of the Netherlands in the global health space. And we have a question from Emma Dickinson-Krager on that particular issue.
I'm Emma Dickinson-Craig. I'm a medical doctor and also an environmental health researcher. I think it also kind of tunes into the question you asked about collaboration. The establishment of the Global Health Hub is very promising.
Yep.
And I think with the Global Health Pact, there was a lot of focus on justice. And I think this aligns with global commitments as well. But practically speaking, how would you inform us how partnerships between the global north and the global south and the power dynamics that are at play there, how this will take place and how evidence from the field can be fed into this, this global health hub?
That's a very timely question because the session right before this one is on decolonizing global health. Everybody's talking now about it, so the future of partnerships.
Yeah. Thanks. First of all, and I think you may realize that very well, or you may all realize that very well, also in my own experience, I've been a clinician, I've been a researcher, I've worked as a clinician and a researcher also internationally, for some part also abroad. I've also for long been a healthcare executive and now a minister. And in each and every one of these roles, from my own experience, but most likely also from yours, otherwise you wouldn't attend the meeting here, you can connect and collaborate and make great achievements internationally. If I look at my own previous fields, and one of the areas which I did a lot of focus on and a lot of work on was on cancer screening and public health, which is very, very relevant in terms of equity and access and information, because we know that usually on a global level, people who have the highest risk for particular conditions, such as cancer, have the lowest access to information, the lowest participation rate when they are offered cancer screening programs, have the worst outcomes, do not give the follow-up, etc. What we did was always look for international collaboration, share examples, do collaborative studies, have frequent meetings, etc. And that's what you do. That's one answer in believe in your own strength and make the connection and share the experience, whether it's in your local network here, in your own institute, within your national organization or your European organization, and also with people like from the Ministry of Health. Apart from that, in collaboration with that, this is also what we do as a minister. And I see it, and I can give you my example, but you can all do it in your own role. It is a perfect continuum. What I do now as a minister is exactly what I did before as a researcher, as a clinician, and also as a healthcare executive, sharing and connecting and working together. Now, where you can then act as a minister is helping also to provide the funds or stimulate certain programs, discuss it as an EU level, for instance, work on regulations, etc., etc. But the most important is first believe in your own strength and work on it.
And that's where it's also might be nice to remember we are at a biannual conference of FESME, the Federation of International Societies working in global health. And this is a European platform. Yeah. So it's also maybe, so we have a Dutch Global Health Hub, but we also part of a wider European and global family that we can collaborate with.
Yeah. Yeah. If I look at if you allow me, just for the example, for instance, if you look at the international, we know very, very well that for all of your countries where you have an indigenous population, for instance, the outcome in healthy life years, life expectancy overall, and also burden of disease is almost without any exception is always worse for the indigenous population. If I look again at my own field of cancer and cancer screening, everywhere. From South America to North America to the Asia Pacific to Europe to everywhere. Well, that's already an area where you can very important connect, but what also we can make a political statement about.
Thank you.
So we only have
We
4
are
minutes.
aware that there are many more questions, both people who submitted, so thank you for those questions, but also other people here. We do need to wrap up because we also want to be mindful of your available time. What I would like to ask everyone before I hand back the words to Professor Grobbee is to remember your questions you have now and ask them. Talk about it with each other and really continue the conversation, because that's, again, how we can altogether shape a more equitable and sustainable world. Renzo, would you also like to have a final word before we...
Yeah, well, and coming from a more international perspective, you know, great to hear about the Dutch perspective and also initiatives. For sure, there are more that needs to be done. And I hope that this conference is just the beginning of not just dialogue, but real collaboration between all of our countries to address all of these major challenges affecting us all.
Yep.
Let's give a big hand to the minister.
Thanks very much, Ernst, for being here. It's much appreciated. Not only are you a Minister of Health, but also a Minister of Health with a view on global issues and with thoughts on the issues that are so prominent in this meeting. So we are doubly blessed by not only your presence as a politician and a minister, but also someone who can express thoughtful concerns and add to what we learn in this meeting. So thanks very much. Joyce, Renzo, thanks very much for moderating. All those in the room that had questions, some of which we could address, thanks very much. And Ernst, there's one thing I should not forget. I know you're wearing glasses every once in a while. We want to give you an extra...
I can't read without glasses.
Okay. Well, then this may come on handy. We have an extra pair of glasses. We will assure it will be brought to your ministry with a low carbon footprint. And I hope it may help you, your colleagues, future ministers to have a planetary health look on policies in a day-to-day basis. Thanks very much.